Have you ever considered why there is no such thing as heart cancer? In this video, we'll explore 12 unusual signs that could indicate damage to your heart. Pay close attention, because your ignorance might just cost you your life. People often think heart damage comes with obvious symptoms. They're wrong. Sometimes it sneaks up on you through subtle signals like silent inflammation, unnoticed stress, or even poor dental hygiene. Yeah, I said it. Your gums might be trying to send you an important message. True story. My grandma had arm pain and she vomited right before her heart attack. Let's dive right into it. First up, gums bleeding easily. You might think it's just a minor issue, but it's a soft signal that your heart is in trouble. Gum disease or periodontitis has been shown to be linked with heart health. The inflammation caused by persistent gum disease can lead to swollen and bleeding gums. The same inflammatory response is believed to increase the risk of heart disease. Why? Bacteria from inflamed gums can enter your bloodstream, potentially contributing to the buildup of plaque in the arteries. So, if your gums bleed when you brush, it's not just about preventing cavities. It's about keeping your heart in check. Dr. Thomas Levy's research has shown a significant link between oral health and heart disease, emphasizing how critical it is to take care of your gums. In his book, Hidden Epidemic: Silent Oral Infections Cause Most Heart Attacks and Breast Cancers. Dr. Levy demonstrated that infected teeth, infected gums, infected tonsils, and even infected sinuses always cause enough discomfort to drive us to a physician or dentist. But none of these are life-threatening. Right? Wrong. In fact, dead wrong. They often kill, and they typically do it in a silent fashion. The overwhelming evidence in Hidden Epidemic proves that these oral infections are responsible for most heart attacks. Regular dental checkups, proper oral hygiene, and addressing any signs of gum disease early are key preventive measures. Think of it as flossing for your life. Have you learned something so far? If so, it would mean the world to us if you give us a thumbs up and support this channel. Moving on to our second sign, erectile dysfunction. Yeah, it's a touchy subject, but grow up. This condition isn't just a personal inconvenience, it's a critical health indicator. Erectile dysfunction happens when there's insufficient blood flow, usually due to clogged arteries or heart disease. The same processes that lead to heart disease can mess with blood vessels all over your body, including those leading to sexual organs. So, if things aren't working down there, it might be a red flag for your heart health. Address lifestyle factors, seek medical advice, and manage other heart disease risks. Don't let embarrassment stop you from saving your life. Now let's talk about the third sign, anxiety. Not just any anxiety, but unusual or prolonged anxiety. This isn't just about mental health, it's about your heart. Anxiety can affect your heart rate and blood pressure, and sometimes it's a sign of an underlying cardiovascular problem, especially if it's sudden, severe, or comes with chest pain or shortness of breath. Sure, anxiety has many causes, but don't dismiss it, especially if it's a new condition or has significantly intensified. Consulting with healthcare professionals to explore both psychological and physical facets is vital in ensuring heart and overall health. Don't just pop a pill and hope for the best. For our fourth sign, let's get serious about calf swelling or pain. It's a potentially alarming indicator of peripheral artery disease, often linked to heart damage. When the arteries in your legs become narrowed or blocked, it leads to reduced blood flow. Recognize this symptom early. It can signify broader cardiovascular issues, including heart disease. If your calves are swollen or painful, especially after walking or climbing stairs, pay attention. Peripheral artery disease is commonly associated with atherosclerosis, where plaque builds up in the artery. Prevent further complications with lifestyle modifications like regular exercise, a heart-healthy diet, and quitting smoking. And consult a healthcare professional. Recognizing and addressing these early signs can be pivotal in maintaining your heart health. Let's discuss snoring or sleep apnea next. Often dismissed as mere nuisances, they could indicate more serious heart health issues. Sleep apnea is characterized by pauses in breathing or shallow breaths during sleep. It's not just loud snoring, it's a severe disorder that disrupts your sleep cycle and reduces the oxygen flow to your body, putting a huge strain on your heart. Those with sleep apnea often experience higher blood pressure, irregular heartbeats, and are at greater risk for heart disease and stroke. If you or your partner notice heavy snoring or gaps in breathing, consult a healthcare professional. Treatment might include lifestyle changes, CPAP machines, or other interventions. Taking sleep apnea seriously can be a vital step in protecting your heart. Turning to our fifth sign, a sudden onset of extreme weakness. This isn't just feeling tired. It's an intense, overwhelming sense of exhaustion that can appear without warning. It's your body's way of signaling that your heart might not be pumping effectively, leading to reduced blood flow and oxygen delivery to your muscles and organs. This symptom is particularly concerning when combined with other heart attack signs like chest pain or shortness of breath. Immediate medical attention is crucial if you experience such extreme weakness, especially if it's sudden and unexplained. It could be a life-saving intervention. Now, let's talk about irregular skin rashes or unusual spots. They might be more than just a skin issue. They could be subtle signs of heart disease. Certain types of rashes, like psoriasis or eczema, are linked to an increased risk of heart problems. These skin conditions are marked by inflammation, a critical factor in the development of atherosclerosis, the hardening of the arteries that can lead to heart attacks. Additionally, some rashes or spots can result from poor circulation, another sign of heart issues. Pay attention to any sudden or chronic changes in your skin's appearance and consult with a healthcare professional to explore the underlying cause and connection to heart health. As we look at sign 7, unexplained nausea or indigestion, these could be more than just digestive discomforts. They might signal heart disease. People experiencing a heart attack often have symptoms resembling indigestion, nausea, or stomach pain. The discomfort is typically not relieved by antacids or other gastrointestinal treatments. These symptoms occur because during a cardiac event, the heart may struggle to supply oxygen-rich blood to the digestive system. If accompanied by other heart attack symptoms like chest discomfort or shortness of breath, these signs should not be ignored. Persistent hoarseness is our 8th sign, which might be an unexpected but possible symptom of heart failure. Persistent hoarseness can occur when the heart doesn't pump blood effectively, leading to fluid buildup in the lungs and affecting the voice box or causing a chronic cough. This symptom is often overlooked, but can be associated with worsening heart function. If you experience persistent hoarseness without a clear cause, like a cold or allergy, and especially if it's accompanied by other symptoms like shortness of breath or fatigue, consult a healthcare professional. Identifying and treating heart issues early can be vital for long-term health and well-being. Next up, sign 9, loss of consciousness or fainting spells, often referred to as syncope. This can be a serious indicator of heart disease. Fainting occurs when the brain temporarily does not receive enough blood supply, and in the context of heart health, this can be due to irregular heartbeats or blockages that impede blood flow. It's particularly concerning if the fainting is sudden and without any preceding symptoms. While fainting can have various causes, recurrent episodes, or those associated with chest pain or shortness of breath, necessitate immediate medical evaluation. Early intervention can be critical in preventing more severe heart-related events. For our 10th sign, let's consider sudden or excessive sweating. This might be an important cardiac warning. Unexpected and profuse sweating, especially when you're not exerting yourself, can be a symptom of a heart attack or other serious heart conditions. It occurs as the body reacts to stress signals from a heart struggling to function properly. This kind of sweating might be accompanied by other symptoms, like chest pain or pressure and shortness of breath. Recognize this sign as a potential heart issue, rather than attributing it to less serious factors. If you experience sudden unexplained sweating, particularly if it's severe or accompanied by other heart symptoms, seek immediate medical attention. Now, let's discuss sign 11, unusual or prolonged anxiety. This isn't just about mental health. It can also be a symptom of heart disease. Anxiety can manifest physically, affecting your heart rate and blood pressure. In some cases, it might signal an underlying cardiovascular problem, especially if it's sudden, severe, or accompanied by other symptoms like chest pain or shortness of breath. While anxiety has many causes, don't dismiss it, especially if it's a new condition or has significantly intensified. Consulting with healthcare professionals to explore both psychological and physical facets can be vital in ensuring heart and overall health. Finally, sign 12, decreased tolerance for exercise. This significant indicator shouldn't be overlooked as it might denote heart damage. A sudden drop in your ability to engage in physical activity, feeling unusually fatigued during or after exercise, or experiencing symptoms like shortness of breath or chest discomfort could all point to cardiovascular issues. This decrease often occurs because the heart is less efficient at pumping blood and oxygen to the muscles, possibly due to heart disease or blockages in the arteries. If you notice a marked change in your exercise tolerance, consult a healthcare provider. Addressing this symptom promptly can be critical in identifying and managing heart conditions effectively. And now for the part you were hoping I'd forget. Don't underestimate the power of quitting smoking and limiting alcohol consumption. Both these habits have a profoundly negative impact on heart health by restricting blood flow and oxygen that your body and vital organs desperately need to thrive, not just survive. Want to know more about what alcohol does to your brain and body? Check out our video on that next.